Alright guys, in this section we're going to cover the large spinal cord model. So we're going to cover the different areas, I guess. So this big spinal cord model right here. So you have the cervical spinal nerves coming off there. You have the thoracic spinal nerves coming off there in between the ribs. You have the lumbar spinal nerves coming off there. Sorry, lumbar spinal nerves. And then you go down and you can see the sacral spinal nerves coming off laterally, laterally in between the sacrum way down here, okay? Then we have a couple specialty terms that you need to know, okay? So you have the, let's get a little bit closer here, okay? So look at this model, and you see the spinal cord, when it comes to an end, it comes to a point, and that's known as the conus medullaris, or the medullary cone. It's just that point right there. When it continues down, that single line that's not really it's not actual nervous tissue anymore. It's called the filum terminale. And so on this model right here, I'll show you. The filum terminale is coming off the bottom, the very, very bottom like that, okay? So that's the filum terminale, piece of connective tissue coming down off of the medullary cone. Below the medullary cone, you see this. It kind of looks like a horse's tail, and it stands for horse's tail in Latin. This is the cauda equina, or cauda equina, okay? Then we have some specific nerves that you need to know on this model. Okay, so we're going to flip it up here. Okay, you see this little nerve right there? That's the phrenic nerve, okay? And that is a nerve of the cervical plexus. Then you see all these ones. This is the beginning of the brachial plexus, okay? So those are some special nerves that you need to know, okay? So when they first come off the brachial plexus, okay, the first thing you need to know is all the nerves that make up the brachial plexus, don't you? Okay, so cervical nerve 5, cervical nerve 6, cervical nerve 7, solo, cervical nerve 8, and thoracic nerve 1, okay? So cervical nerve 5 and 6 make up the superior trunk. Cervical nerve 7, once it gets a little further out, parallel with the other trunks, it becomes the middle trunk. And cervical nerve 8 and thoracic nerve 1 make the inferior trunk, once they become parallel with the other trunks. Okay? Then they do all this mishmash of stuff, and they become cords at the edges here. Okay, so don't be concerned with all the mishmash between the trunks and the cords. Okay? So, back in the back is the posterior cord, okay? And then on top right here, we have the lateral cord, and then we have the medial cord down below, okay? And that is it for this section. Alright guys, one thing I missed on the large spinal cord model was the enlargements. So, right here, okay, we have the cervical enlargement as it enlarges right there in the cervical region to make room for the brachial plexus to come off. Then as it goes down, it enlarges here at the top of the thoracic, or at the bottom of the thoracic, it enlarges to give rise to the lumbar spinal nerves, and that's known as your lumbar enlargement, just above the medullary cone, or the conus medullaris. Okay guys?